This show is for informational purposes only. In view of the complex nature of health and disease, it is only recommended that you change your current treatments or healthcare practice with the direct assistance of a health professional. You can contact Dr. Dale if you desire to achieve true health. Call his office at 931-591-2010.
Awesome. Somebody posted about being in here today. I love seeing people already posting online about visiting the office, getting their kids well. So had a lot of children this afternoon, folks. A lot of children came in today. From newborn, 6-week-old baby with unexplainable fever to a couple children with migraine headaches. I tell you right now, whatever you want to call it, whether you want to call it the universe and energy or the good Lord, you know what, I call it the good Lord. You know, when you start focusing on something, you know, I was focusing on childhood migraines, and that's what the topic is this evening, is discussion regarding childhood migraines. And this could result in adults being, their life being improved by understanding what causes migraine headaches and how they can fix that. What's the proper fix? What's the cause of migraines? But focusing on this today, you know, spent probably 6 hours or so just reading through the research, the stuff that I already had accumulated, to finding more and more information about this subject, and just really cluing myself into, channeling my energy and focus on, resolving migraines in so many patients over the years, and just channeling this energy into focusing on giving parents out there the best opportunity to see their children not have to deal with migraines. I can't help it, but I won't mention names. But the reality is, just working with it's such a blessing to get to work with my hands and see children get well so quickly. Literally, less than 10 minutes ago, I got to adjust a little girl and see that she went from having a migraine headache or having a headache here in the office, and adjust her, and the look in her eyes, and she starts to smile, and mom's sitting there, mom's just sitting there asking her, how you feeling? Are you feeling better? I'm asking her too, how you feeling from your adjustment? What are you feeling different in your body? Are you feeling better? She's smiling. She points to her head and gives us that little smile, letting us know that she's feeling better, and indicates she is. Just to see children just respond so quickly when you address the underlying cause of migraines, which is misalignments. It's simply put, the primary cause of migraine headaches is misalignments of the upper cervical spine. And we're going to talk about proper correction, because I know a lot of people out there may be thinking to themselves, well, I've tried chiropractic care and it didn't work for me. I've seen that in my own patients. I have another patient, Valerie's given me permission to actually speak about her testimony and her case. She went through a car accident in 1997. She went through chiropractic care, which significantly benefited her in terms of resolving her neck pain and headaches to a degree, but then the migraine headaches, those persisted on. So the migraine headaches, so the tension type headaches, those types of things went away, the neck pain went away, so she got chiropractic care for that, and she was under care for several years. Went regular for maintenance care because it did benefit her, but the migraine headaches just weren't resolving with that type of chiropractic care. And over the years, the migraine headaches continued to get worse. In Valerie's case, at one point in time, she had a migraine headache that lasted 25 days straight. And what's significant with this case is that, the reality is no one was addressing the primary subluxation in her neck, which was a rotation of her atlas. And the only way we came to find that was the fact that she came in here because a good friend of hers said, I know that you're going to another chiropractor, but I want you to give, the Wild Doc a try. I want you, and back then I wasn't called the Wild Doc, I was Dr. Dale, just good old boy. And she got, one of my patients got her friend Valerie, get in here. She's like, just give him a try. Take another look at it. You've been lasting 25 days. Nothing's working. Just give him a try. And we took some very specific x-rays of her neck. We wanted to see what position the atlas is in. So for proper x-rays, x-ray analysis, I believe taking a view from the front, the side, and then from underneath, in essence, of the skull and the atlas to see the rotational component of the atlas. If there's torsion there, that's the primary thing we see with migraine headaches. In more than 90% of migraine sufferers, including children, we find rotation of the atlas, which will put tension on the dura mater will compress and cause a spasming effect to the occipital muscles, for which medical doctors actually want to go in there and cut some of those occipital muscles out to decompress the nerves. Rather, why not actually correct the alignment of the spine that was causing the muscles to constrict or contract improperly? So, just a side note there. But we corrected that misalignment of our atlas with a specific instrument adjustment as well as by hand. And within 2 weeks, migraines resolved completely. After the first adjustment, she was significantly less pain. After 2 weeks of treatment, that was the last time she had any type of headache, and she's continued on with maintenance care in my office for 4.5, going on 5 years now with 0 migraine headaches. 0. Because we addressed the underlying cause. And that's one of the biggest things I want you to take away from here. This talk tonight is the fact that we're going to be addressing the underlying cause. It's the primary thing I'm speaking about. I know that there's some alternative treatments out there that are safe and somewhat effective. I mean somewhat, because if we don't address underlying causes, we may be only partially effective in relieving symptoms. I want to know that I'm correcting cause, and I do believe we need further research to look at the evidence to see if we have further benefits beyond just relieving the migraine headache, such as in the case of migraine sufferers having increased risk of stroke and heart attack, especially in adults. We will discuss the information and research that shows now that even in childhood, they will actually see changes in the heart muscle and in the arteries feeding blood flow to the heart. So in the blood vessels surrounding the heart, they see changes in the thickness of the arterial walls, and that's an indicator of cardiovascular disease and inflammation to those arterial walls occurring at childhood. In comparison, children without migraine headaches did not have increased arterial wall thickness or dysfunction. So it is a sign, it's an indicator. Migraine headaches especially are an indicator, and frequency didn't matter. All children with migraine headaches had cardiovascular abnormalities occurring, and that was a sign of the beginning stages of cardiovascular disease. So headaches are a sign of cardiovascular risk, cardiovascular disease process beginning. And it's not the cardiovascular disease starting it or causing the migraine headaches, it is actually neurological dysfunction, and we'll talk about that in the literature. Now, why did I want to discuss this subject? Well, last week, Journal of the American Medical Association sent me an email. I just get their emails. I sign up for emails. I want to stay up on the medical literature and the research. If you watch me and you've listened to my videos, you'll find that I read from research, I speak from research, because analyzing the data, analyzing the research for ourselves, thinking critically for ourselves is the only way that a practitioner, a medical physician, or a chiropractor, or any type of healing physician is going to understand conditions fully. They're going to understand what they can do to help people. Disease processes are multifactorial. We need to understand what those multiple factors are, and we need to correct them all to get and reach the optimum health. So again, I'm going to be focusing on the causes of migraines. I'm not going to talk about a whole lot about other alternatives other than correction of the cause, which within the medical literature and what I've found is misalignments and problems with the cervical mobility or strength of the muscles of the cervical spine. So we'll be talking about that. We've got about 18 people online. Welcome, everybody. Hope you're having a great day. I look forward to answering some of your questions. I want to turn my volume down here real quick. Again, we do these for local television. We have these on YouTube. You can comment there. You can comment here on Facebook. Long-term discussions will typically be on YouTube or on thewilddoc.com. If you want the medical literature that I'm discussing this evening, maybe you want to bring that to your medical physician and talk to them about the reality that they may have given you a medication that causes more harm for your child. And what was unique about one of the instances here this evening is that the parent actually asked the neurologist at one of the prestigious medical hospitals here in the local area, Nashville, Tennessee. Not going to say the name, but it begins with a V and ends with a Bilt. But yeah, most people know what I'm talking about. But supposedly they're the best. Well, they're like, we don't really know what's causing the headaches. We don't really know why, They couldn't give any firm diagnosis. They couldn't explain why the child has had headaches for so long and throwing up and having, aura, sensitivity to light, sensitivity to a bunch of things, to sound, all these things. It's like clearly it's childhood migraines. 4 years old, this little girl. So we begin to correct this. Now this girl's going to get well. And I want you out there to pray for that because, you know, I'm a human being and God forbid if I can't correct that misalignment. I am praying that I can. We had good results after this first adjustment. So hope and pray for that continuing on and this little girl to get well. But again, going back, neurologist says, well, we can try migraine medications. We didn't want to diagnose your child with migraines, but we're going to give her migraine medications, which are anti-seizure medication, antidepressants oftentimes, or muscle relaxers. Or they give them anti-inflammatory drugs in the acute phases. But mom's like, well, is there anything natural? And the doctor wanted to actually say, well, natural would probably have more side effects and negative effects than our medications. But in reality, the Journal of American Medical Association actually just published, literally just published. I would hope that this neurologist had read this before I did, but probably not. So I get frustrated here, and this is why. I know that a lot of my listeners understand why I get frustrated, but I get so frustrated with the fact that medical physicians don't stay up on their own medical literature. They're the ones prescribing the drug. They ought to know about this before I do, because that's their job. But if they're not doing their job and there's potential to harm to come to little girls and children out there in this world or harm to come to adults, I don't care who it is, any person's life, creed, color, race, whatever, it doesn't matter. You know what? Those lives matter to me and they should matter to everybody else. But it seems a lot of times people don't want to take their job seriously. Medical physicians don't stay up on the literature. They could have prescribed that medication, caused significant harm to that little girl. And they don't even want to say what it possibly is. They can't even give a firm diagnosis. They didn't even do any tests actually. They did blood work. Nothing wrong with the blood work, okay? Why don't you do actually a neurological assessment for which they have indicated childhood migraines are a sign of autonomic dysfunction being the primary cause of that condition. Autonomic dysfunction is the primary cause of childhood migraine. Migraines across the board is autonomic dysfunction, brainstem abnormalities in terms of the neurological balance between the parasympathetic sympathetic systems. Now, they will find in migraine headaches that you have a high parasympathetic and a high sympathetic tone. So you're high in both systems, which one of my children today, again, call it energy, call it God, call it whatever you will. You know what? When I'm studying nothing but childhood migraines today, and then I get 2 children coming in with childhood migraines in literally a couple hour session of my office being open, guess what? You know what? They're sent to me. That's the way I feel about it. You know, I was prepared, I was ready to help those children to the best of my ability. Maybe it was just waiting until I was ready for that moment to be able to explain to the parents exactly what's going on. And guess what we found? In both those children, high parasympathetic and high sympathetic tones in their autonomic dysfunction. So their autonomic systems were not functioning in balance. They were high on parasympathetic and high on sympathetic. Boom, that's it. That test is more effective at telling us what was going on in those children than any of those medical studies. But guess what? Right now, I'll bet you the amount of money that Vanderbilt just, whoops, sorry the name. But you know what? I would bet to you right now, it doesn't even matter. You know what? I'm okay with calling them out. You know what? I'll call out another Doctor's Care here in town. They gave a guy after he fell off his bicycle and skinned his elbow. I mean, it was bruised. It was swollen. Okay? They gave him steroid medications, folks. Okay, I'm going to rant about this. This is what needs to happen. This is the rant of the week, I guess. I don't always have them, but usually I rant every week anyways. But get this. He has diabetes. He fell off his bike, okay? Skinned his elbow up, bruised it, didn't break it, swollen. They tell him to take the max dosage of Tylenol. That was one of their prescription drugs, okay? And then the other one was steroid medications. What? He's got diabetes. Guess what the side effects are of steroids? Severe hyperglycemia. Blood sugar regulation issues, folks. What are they doing? And he said they didn't even ask him questions. They didn't take a health history or anything. They gave him 2 meds. They skin your elbow. Here's steroids and some anti-inflammatory meds. See you on your way. You know what? That's unacceptable. Because they could have caused massive harm to that man. Had he not, he said they didn't even give him any information on properly taking the medications or properly understanding the side effects of the medications. That's improper informed consent right there. That was an intent to treat by the medical physician without proper education of the side effects and risks of that medication. That is medical malpractice. Okay, I've just called somebody out in my hometown. I'm okay with it because it should be unacceptable to anybody else in my community, anybody else in this world right now, if doctors can go about giving improper informed consent, committing medical neglect, medical malpractice, possibly harming somebody, for which how many other patients have they harmed in that similar situation? Who knows? But that's unacceptable, and they should be called out on it. I'm just sick of just improper treatment or doctors who don't care. Ironic, isn't it? So here we go. Let's go back to the major. 32 people on. Maybe you guys like to hear me rant and rave. But you guys get me. Give me a thumbs up, something that you understand the frustration I have and why I feel like enough's enough in this medical community, in this medical world. We need to do what's best for our patients, not what's best for profits. What's best for people is what matters most and should matter most to our medical physicians, to our medical community, to any person in the field of healing practices, chiropractic or other, everything right now. All right, so why did I get on the subject of childhood migraines? This Journal of American Medical Association right here in front of me published, get it, June 19, 2007, Journal of American Medical Association Neurology edition, all right? Get this, all right? So according to the CHAMP study was childhood and adolescent migraine prevention study, all right? They're stating some harmful effects of the medications. They're looking to see if those medications were safe and effective for children, but guess what? After a 4-week baseline run-in period, participants were randomized to 2-to-1 fashion to either one medication, amitriptyline, and I think it's Topamax is what it is, topiramate. Seriously, have you guys all seen that video where it's like, how do they decide what drug name they're going to use for a new drug? It's like they just smash the keyboard until like whatever comes up. They're like, that's the name. I don't know. I mean, the names that come up for drugs, it's like, where did you come up? It's like, how did you? And then placebo. So guess what, folks? The placebo worked 60% of the time. The two drugs worked roughly 50% of the time. Guess what? A placebo is more effective. Now, I explained this to another patient and the parents, okay? More or less the parents. I explained this today. You want to know why a placebo effect is so effective in migraines? Because you'll see two different types of migraine headaches, the way in which the autonomic dysfunction can occur. You can have high parasympathetic and high sympathetic tone both, or you can see high sympathetic, and that's one of these research studies evaluated this. They'll see high parasympathetic and sympathetic, so you have autonomic dysfunction, so you have high tone of both the two systems of the body, or two separate components of the nervous system, parasympathetic and sympathetic. Parasympathetic is your pee, feed, and breathe. That's the way we remember it in chiropractic school. Pee, feed, and breathe. Your calm down, your sleep, your recover, your heal mechanisms occur, your anti-inflammatory effects occur during a parasympathetic effect. Now your high sympathetic tone is your fight or flight system. So that's your survival in a situation of stress. So you have two, both are high in one type of migraine headache, and then you have a high sympathetic tone in the other type of migraine headache. Why is it that you can actually have a beneficial effect through a placebo effect with migraine headaches? It's simple. It's understanding the way neurology works. If I give you something comforting, if I tell you something comforting, let's say we're all out there in the middle of the jungle right now and we're running from tigers. We're in an environment right now where there's a killer tiger on the loose. All right, so if I just sit down with you and I say, listen, everything is going to be fine. We are going to get out of this. I promise you I'm going to take care of you. I'm going to make sure that this tiger doesn't get to you. We're going to be okay. I didn't actually change the situation. All I did there was give you a psychological trigger to say everything's going to be fine. So the power of your mind says, I'm going to be okay. So a placebo effect, when people believe they're taking a pill, and these studies were done, this one was done in children. The studies that I'm talking about in terms of the drugs on placebo as well were done in adults as well. So thinking that you're taking something that's going to have a positive effect on you brings thinking everything's going to be fine, that I'm going to get well, that I'm going to be okay. Your sympathetic tone will come down. If you're out there in the tiger and I just calmed you down and I gave you reassurance that I was going to make sure that everything was going to be okay, your sympathetic, your fight or flight is going to come down. So your stress response was going to come down. Well, if you're in a high stress response, high sympathetic tone, your body is releasing inflammatory cytokines. Now, that's one of the components for which when they see inflammatory cytokines elevated within the bloodstream of individuals with migraine headaches while they're having episodes, that's where they see and why. That's why they see that cardiovascular risk factors go up, such as your increased density or increased clogging of the arteries surrounding the heart. So that's why migraines are tied to an increased risk of stroke and heart attack in adults. They don't know whether they see it starting in children, but they obviously don't see a significant number of children having strokes and heart attacks at childhood, but they know that the disease process to the cardiovascular system is starting to begin. So that's the inflammation, the inflammatory cytokines being released when the body's under a lot of stress and the autonomic dysfunction is out of whack. So get this, if we can bring that back into balance, chiropractic care, correction of the spine, general mobilization of the spine only, that's it, literally showed a decrease in inflammatory cytokines in clinical studies doing blood work on individuals after chiropractic adjustments. So reducing inflammatory cytokines has a beneficial effect on the entire system, the entire cardiovascular system, and getting the body out of that inflammatory state. And they've shown that autonomic dysfunction can be corrected through spinal correction. So right there, phenomenal results with chiropractic. But going on with the study, why was I concerned? Why did I feel this was a desperate need to be talking about this subject? All right, folks, make sure you're sharing it. Get online. We got about 30 people on. I love it. We're staying consistent with that. We got Jennifer on. Donna, welcome. Cookie, great to see you on there. Elizabeth, stay tuned. Lisa, thank you for tuning in. Looking for a chiro like you in LA. Any ideas? Man, I had a buddy just talk to me about LA. So hopefully some of my friends, if they live out there in the region, they'll know who to send you to. But you know, ask for a neurologically based chiropractic care. Make sure that they're doing subluxation based, that they're correcting misalignments for improvement in autonomic function. They're not just doing general range of motion manipulation. I'll tell you another story real quick. I had a patient, military veteran. This girl was blown out of a Humvee. She's literally said that at a time going into Iraq that they didn't have doors on their Humvees for a short period of time. I was like, are you kidding me? But she said, yeah, it was ridiculous. So she literally had roadside bomb, blew their Humvee underneath, projectile. She flies out of the Humvee. She lands on her rear end with her body armor on and everything, actually compresses her L5 vertebra, breaks her lumbar spine. So she got med boarded out of the military, but throughout the med board process and getting sent home, she had severe migraine headaches, insomnia, PTSD, lots of health conditions. She was on 8 medications. We were able to get to her point where she was not on a single medication, not a single medication needed. Her PTSD scores came way down, got her body out of that stress response. And that's another thing, if you want a side note here real quick, is that autonomic dysfunction, they find that military members who deploy and they already have a decline or reduction in their adaptability in terms of their heart rate variability studies, that they have an increased likelihood of coming home with PTSD because their body isn't able to adapt to those stress factors over there overseas. Now, she had physical trauma and psychological trauma from that event. She comes home, she deals with severe migraine headaches. We resolved those things by correcting her upper cervical spine. But she went to the chiropractor on post here, and I don't know if it's the same one or not, but the reality is he gave her horrible advice. One, I don't know if it was but he was just doing general mobilization manipulation, just taking the head, twisting it one direction, then the other. She said he literally never took x-rays, never did analyzing of any sort, laid her on the table, twisted her head one way and the other way, grasping her head. Bad idea in terms of autonomic dysfunction, especially with migraines, because if you have a rotation of the atlas and a trauma like that, she could have ligament instability. And we had to address those factors. So we had to give her exercises to strengthen the musculature and endurance of her muscles up here. I have another study where they showed that the head posture and the cervical muscles, the neck muscles, were very important. Without endurance of those muscles, you'll get shifted out of alignment so easy. So we had to strengthen her muscles as well as stabilize and adjust into the proper alignment. Through doing so, we resolve her migraine headaches, her insomnia goes away, she benefits in multiple ways, gets off of all those things. But she literally had the chiropractor tell her to take her neck and try and twist it that way and see if she could get it to pop. She said he told her to do that. That would make her alar ligament damage far worse, and that was the one thing we found. She had damage. So somehow during that blast, she had a concussion as well as a lateral shift in her neck and head that ruptured the ligaments of her neck. So we need to be very careful with correction of that. So, you know what? If you're asking me, who do you go to? I've got migraines. You're out there right now. You're saying to yourself, I've got migraine headaches. Dr. Brown, you know, what do I do? How do I get to a good chiropractor who's going to correct these things? There's a difference in techniques, and there's a difference in, you know what, people who never stop learning. I had a buddy of mine tell me this just the other day. He's like, you're one of those few people in the world that just never stop learning. I crave knowledge and learning. Like I want to understand this stuff because it's not just about me. Every single person that comes through my doors is relying on me to be the best of the best, to be the person that's going to give them the answers they need to recover their health. So I have a responsibility, I believe, greater than maybe not as much as firemen and police officers at times, you know, situations, but, you know, it just as important because people's lives are at stake. You know what if that veteran, what if that young lady got med boarded out, never corrected her spine, she continued on with the migraine headaches, the insomnia, the depression, the PTSD, all these health problems, all this suffering, just given medication after medication by the VA. You know, doctors telling her there's nothing you can do, you're going to live with it the rest of your life. You know what if she said, you know, if enough's enough of this suffering, I'm going to take my life. I can't spend time with my family anyways. I can't live like this anymore. You know what? Like 22 U.S. veterans committing suicide every single day. So I'm giving an announcement out there for everybody in my local area right now. You know what? Shameless plug. Get into my office. Let me help you. If you're a military member, you're suffering with migraine headaches, you've got a TBI, I'll tell you right now, I've got multiple TBI patients who have seen massive benefits getting off of medications like no other. We get them off of all of their drugs the majority of the time, even with TBIs. All right, we get them well. We focus on the causes of those conditions, and migraine headaches is one of the biggest things that is affecting a lot of the TBI sufferers. You know, but 4th of July is coming up next week. You know what? Next week and the following week, I am allowing military members to come into my office for a significantly reduced price. I'm giving myself a shameless plug right now because I want to help those military members. They fight for our freedom, and freedom isn't free. You know what? It's time for me to repay that and saying thank you to those military members, and that's what I can do. All right, so get in here, let me help you. All right, back to the literature, back to the research. So all I can say is you got to ask a lot of questions. Oh, so now off topic, here comes another squirrel. Go back to the migraines here in a second. Get this. I had a patient, her son is seeing significant improvements with his aggressive tendencies. He's on the spectrum. A lot of you understand what I'm talking about, the autism spectrum disorders. He's on the spectrum. She gave me permission to talk about this. Again, going to another hospital here locally. It begins with a V and ends with a built. All right? So they wanted to do EEGs on him. So they did a brain scan, looking at his brain, and they say, see, we see abnormal activity in these regions of his brain. So he's got bipolar disorder. Or not bipolar, I apologize. They said that he had OCD. Obsessive compulsive disorder. And the mom's like, he doesn't do any of that. And they're like, well, this is typical findings on brain scans that we see in OCD patients, in OCD people, and spectrum children, so we're going to go ahead and put him on Prozac. Huh? And mom's like, he's not on any medications. I don't want him on any medications. And what are the side effects of these medications? She said she just started asking questions. Literally, the medical physician tells her, you know, the reality of the fact that you're asking so many questions, actually, it solidifies your son has OCD because you're probably OCD too. So for asking critical questions about the nature of that medication, the harms of that drug, the risk, which cause an increase in suicidal and homicidal and aggressive tendencies in children. Are you kidding me? Why would that doctor do that? The child isn't expressing any symptoms of OCD, but because of an EEG, that's just one more thing that they want to use to put more people on dangerous drugs, to see the side effects come about, to make more profits over the long term. That's junk. That's horrible medical practice right there. Just because the mom wanted to know the harmful effects of that drug, the doctor wants to literally brush her questions off and tell her that she's got a psychological condition and that just confirms her son's got a psychological condition. Is anybody else upset about that? Like, that ticks me off. So, all right, again, let's get back to the research here. All right, I'm going to read through some of these highlights and then I'll talk about it. So again, going back to the Journal of American Medical Association Neurology, 2017, participants in 2 medication in the 2 medication arms had more, remember, if you're just tuning in, the placebo is more effective than the drugs. But the 2 medication arms had more adverse events than those in the placebo arm, worrying some. So the data, get this, the data showed significant harms. Let me get to I had a list of the medication harms here. Let me read this to you. Right, here we go. Potential side effects of these medications targeted for headache sufferers, according to drugs.com: blurred vision, change in sexual desire. Well, hopefully, since we're talking about childhood migraines, they're not sexually active, but ability. So there you go, adults. Something to know about. Maybe that's why that has had problems. So constipation, diarrhea, dizziness, drowsiness, dry mouth, headache, loss of appetite, nausea, tiredness, sleeping problems, weakness, severe allergic reactions like rash, hives, itching, difficulty breathing, tightness in the chest, swelling of the mouth, face, lips, tongue, chest pain, confusion, dark urine, delusions, difficulty speaking or swallowing, fainting, fast or irregular heartbeat. So increased cardiovascular risks. Hello. They're already at an increased risk of cardiovascular problems. Why are we putting them on a drug that causes an increased risk of the risks they already have? Fever, chills, sore throat, hallucinations, psychological disruption was one of the major side effects, especially in children. Psychological problems, irritability, hostility, exaggerated feelings of well-being, restlessness, inability to sit still, numbness and tingling in the arms or legs, one-sided weakness, seizures, severe or persistent dizziness, headaches. You're treating them for migraines and you literally have a side effect to your drugs of headaches? That's great. Severe persistent trouble sleeping, slurred speech, suicidal thoughts, actions, tremors, trouble urinating, uncontrolled muscle movements. So your child has migraine headaches. Let's go ahead and give them a risk of a bunch of these other more severe issues. Do you guys get that? How is that acceptable? So that's why it led them to believe that they're doing more harm than good. So we are doing more harm than good with our prescription pads. That's what the document says. But should we conclude from this study, from the biggest study ever, the study actually looking at children and the use of medications? Yeah, you should conclude that if the risks are greater than the benefits and the placebo worked just as well, if not better, you should conclude that you're doing more harm with your prescription meds. That's what the research shows. The best peer-reviewed medical literature you now have on your drugs, comparing it to placebo, says what? You do harm, which Hippocratic oath, the Hippocratic or the Hippocrat? The Hippocratic oath says it doesn't matter, just give them drugs and we'll make money. That's the Hippocratic oath. They don't seem to take the Hippocratic oath anymore, which means first do no harm. We as physicians have nothing to offer. Should we conclude that we have nothing to offer? Yes, you should. You should conclude that you have nothing to offer, folks. Your medical physicians have nothing to offer. Well, actually, I take that back. They do. Actually, the research showed what they could actually do. What they could do is they could sit down and fool everybody into believing that they're actually prescribing a medication. Because there's a lot of people that aren't going to watch this, sadly, sad enough to say. This is not going to get out to everybody that has children with migraine headaches. I would pray that it does. Dear Jesus, please allow this to get out to every single person in this world who has migraine headaches right now, and all the parents with children who have migraines. All right, I just said that prayer, and you all can pray with me if you're believers. So, but get this, here's how physicians can actually help in this situation. What they can do is they cannot tell them that they're actually giving the children placebo. The placebo was more effective, and the placebo didn't have the side effects. So they actually have something they can do. Give them a sugar pill, which, the little sucker on the way out, is more beneficial than the drugs. So by age 10 years, the prevalence is approximately 5 to 10%, and it increases further throughout adolescence. Children with migraines miss more school, perform less in school than their peers without migraine headaches. Every month, CHAMP study participants receive education regarding the importance of regular sleep, exercise, meals, hydration, playing, and managing their migraine frequency. But those changes did not resolve the migraine headaches. Importantly, a child's odds of having a headache during the 28-day baseline period were no lower in 4 week than had been in the week 1. This suggesting that the education, the acute treatment alone were not enough to improve migraine frequency. It may be possible to achieve this using supplements that have strong safety records and evidence of efficacy in migraine such as riboflavin. So what I wanted to do is I went into the literature and I found that study. So right there, the Journal of American Medical Association, to refer back to one of my patient experiences already today, was the parent asking the doctor, is there anything natural that's more effective and safer?
His journal, it was a neurologist. His neurology journal actually said, we have a safer alternative, a natural alternative. It's called B2.
So where do you get sources of B2 to possibly help your child with natural nutrition? It's spinach, mushrooms, almonds, those types of things. So you can get it from beef liver, those types of things, but I know that there's documentaries and things out right now saying that we shouldn't, or we should stay away from animal-based products. And I would highly recommend that if you're gonna eat animal products, you gotta go organic. And if you should eat roughly less than 5% or less of your diet should be animal-based products. Animal-based products should be like a celebration. It should be like cakes. It's a celebration type food. The primary bulk of your nutrition needs a plant-based diet for sure. So, but there you have it. Another neurologist doesn't know what he's talking about. We would caution against the suggestion of using acetaminophen or ibuprofen on daily migraine prevention. That could lead to could be medical risks to this strategy, such as bleeding, gastric ulcers, and liver injury. So do not use medications like that for children for migraine prevention. Even acute injury can occur with the use of those medications. Furthermore, frequent analgesic use may provoke medication overuse, headache, counterproductively leading to an increase in headache frequency. Finally, the CHAMP study demonstrated that approximately 40% of children and adolescents do not improve with first-line migraine preventive treatment. In addition, a proportion of the children and adolescents with a migraine were excluded from the CHAMP study eligibility owing to having continuous headaches, medication overuse, and high degree of migraine-related disability.
So they didn't even take the worst cases. So literally in their studies, hey, we're going to try these two medications that we're using and we're prescribing off-label right now to children, so we want to actually see if it's effective or not. So, but let's not take the really bad cases because they could make us look bad. Those are the people that need you the most. Wouldn't you want to know if your treatments actually were helpful for them? I just find that comical. Like, they eliminate the people who are in need, that have the greatest need for help. Anyways. All right, some other studies. I want to get over here to our comments real quickly. Thank you all for tuning in again. New York City, Sharon Time, Kimberly Edwards. Wow, my husband had them 20 days a month for 1 year, and his doc said to just watch it. We found out he was sensitive, allergic to dairy, and maybe wheat. So inflammatory bowel, the gut's the second brain, inflammation of the brain. Yep. All right, so Jennifer tunes in, so true, so sad. Ashley, hey Ashley, how you doing? Welcome for tuning in. Thank you, thank you. That's great help. Call them out. Ashley, I appreciate you letting me call them out. I think we should. We all should. You, I, everybody. We need to put doctors in their place if they're not willing to dive into the literature and do best by their patients. I mean, right there, a neurologist doing wrong by his patients, putting a child at risk, not giving the evidence in his own journals that says riboflavin would be more effective than placebo and more effective than drugs because the drugs were less effective than placebo. Maureen says, rant on. Ashley, thanks for tuning in. Man, I'm excited for y'all. Please do share this stuff. All right, let's get this truth out to the American people, to the world. I've got people messaging me from Yemen. I've got medical physicians from around the world right now, since I've been doing these videos, asking for medical literature that they don't even get to look at in medical school. Regarding vaccines, medications, all kinds of things. So some general information now. The cost of migraine and its treatment, $17 billion in the United States. Medications, office and clinic visits, emergency department visits, laboratory and diagnostic services, and management of treatment side effects. That's where we get our $17 billion we're spending right now on medications. Okay, and the medical community wasting our money and time on improper treatment of migraine headaches, because a migraine headache is not the cause is not the lack of a medication in your system. So when I talk about that, even the riboflavin, even though it's proven effective in reducing migraine, it's not
addressing an underlying cause unless that child has severe nutrient deficiencies. Then we got to look at the nutrition being the primary cause. We got to fix that. But in the majority of cases, it was not a nutrient deficiency. It's just riboflavin has a beneficial effect on the neurological balance and inflammation within the system. So looking at that, we need to fix the underlying cause. Always got to ask the question, is the lack of something, or is this procedure going to correct what's causing dysfunction, what's causing the problem, all right? Is it a lack of something, or is there a dysfunction that needs corrected so that the body can right itself and control the systems properly, vasodilation, vasoconstriction, and inflammation? So understanding that can give us just freedom of understanding to be able to say, am I doing what's best for my body? I see tons of people taking massive amounts of supplements, trying to do things naturally, yet they have major dysfunction in their nervous system, so their digestive tract cannot assimilate nutrients and break down foods properly, and that's why there's nutrient deficiencies. We got to correct their autonomic nervous system function first, lay that foundation, of course, throughout the entire process, keep the nutrition at the best we can. We're ultimately going to resolve the majority of health conditions with those two primary factors. Those are the foundations of your health: a correctly functioning nervous system and a correct nutritional regimen or diet, folks. All right, so look at this, returning to classroom and severe headaches. Doctors say frequent headaches and migraines are among the most common childhood health complaints, yet the problem gets surprisingly little attention from the medical community. But kids shouldn't be missing. They shouldn't be having trouble in school. Advice of pediatricians with little experience in treating migraines or neurologists who specialize in adult care is where people have, and adults and parents have to turn for these conditions. Obviously, we've already learned in the show that they don't correct causes, they don't even look for the underlying causes. Yet the medical literature shows us the underlying cause is spinal misalignments or autonomic dysfunction, which then we can tie back to being underlying factor is the nervous system from the spinal misalignments. So antidepressants and anti-seizure medications are the medications primarily used, which have massive side effects. All right, so here was a follow-up, New England Journal of Medicine, April 6, 2017, again talking about the CHAMP study. Editors here, treatment of pediatric migraine, the placebo. This was administered for 24 weeks, was associated with a clinically significant 61% reduction from baseline in incidence of migraines, which was larger than the reductions from the baseline that were observed in the amitriptyline and topiramate. I wish I need to punch that in the computer and let them tell it to me. So 52% reduction in migraine frequency in one medication and 55 in the other. The placebo had a 61% reduction. Folks, the placebo, New England Journal of Medicine saying the placebo was more effective. But they didn't want to talk about that. No, they just wanted to see that it actually had a reduction in migraines. So then from the baseline, so there's 4 weeks of baseline, looking at the number of migraines these children had, and then looking at 24 weeks of medication use. Placebo worked better, folks. A sugar pill than their darn drugs without side effect. But again, medication over the long term or chiropractic care. That's what I'm... So cervical headache and an investigation of natural head posture and upper cervical flexor muscle performance. All right, this was International Headache Society. So this is off of PubMed. I'm looking for the primary journal here real quick. Done in South Australia. University of South Australia did this research study. They had less isometric strength, less endurance in upper cervical flexor muscles. So the outcome in the study highlights the need to screen for cervical etiology in patients who have suspected suffering of common migraines. So migraine headaches, we have to assess muscle endurance and strengthen those things. So one of the biggest things people will say if they come into my clinic, and if you go into other chiropractic clinics, I encourage this. And I'll say, man, I have some great chiropractors. I do my own exercise. I got friends that go to great chiropractors, so they do the adjustments. They are great at their adjustments. They do very specific adjustments, but I would encourage you seeking out and stabilizing and strengthening your spine along with those adjustments. Some will give you those exercises, some won't. I incorporate structural correction, use of of warm-up exercises prior to the adjustments very specific to realign the spine, not just general mobilization, and then strengthening exercises immediately following. I don't even want my patients to leave my office after an adjustment, go sit in bad posture, and take their spine further out of alignment by sitting in bad posture after I mobilize or improve the alignment of their spine. I want them to strengthen that. So again, that's a physical therapist. Those were done in physical therapy settings, looking at the flexor muscle, the muscle of the neck. That's another component. So this is another reason why you may have tried. So I'm talking to the people that may have tried chiropractic care in the past, all right? You went to a chiropractor, you got adjusted, helped for a little bit through mechanoreception, downregulation of the autonomic nervous system dysfunction, and improvements there, but then it wasn't long lasting. It didn't last very long. So if they didn't address the muscle endurance in the neck and restructure the spine, that may be why. Now combine those things and you're going to get the best results. So spinal manipulation in comparison to medication. So the drugs, head-to-head competition between drugs and chiropractic. They basically had the same amount of improvement, roughly a little over 50%. This is general chiropractic care. This is an adjustment alone. This was no strength and no correction. This was general mobilization chiropractic care. Okay, cervical diversified technique, nothing more. Okay, amitriptyline therapy showed no improvement or slight worsening in the baseline values though, all right? Though 42%, so after treatment, in relation to the baseline values, 4 weeks after cessation of treatment, so discontinuing treatment after treatment stopped, the spinal manipulation group. This is not, again, I hate it when they use that, and when you look at the type of treatment technique, it was non-specific. So headache intensity was still went down, or headache, all right, manipulation, I'm going too fast here, showed reduction of 32% after baseline, 42% in headache frequency, 30% in over-the-counter medication use, improvement 16% in functional status. But what they found was a continuation in these two studies. So here's another one. The efficacy of spinal manipulation, amitriptyline, in combination of both therapies of prophylaxis of migraine headaches. So again, adjusting the spine. After discontinuing treatment, the individuals who had spinal manipulation or chiropractic adjustments, even after discontinuation of treatment, they still showed sustained improvement. So they were able to sustain those improvement if they got their spine corrected, but the medication-only group, after discontinuing medication, symptoms came back, proving that medications don't correct the underlying cause, but chiropractic can, because the sustained improvement is where you get evidence of correction of cause. Another study here, the management of atlanto-occipital and atlanto-axial joint pain. All right, what this is, it's Pain Physician Volume 3, all right, 2000, Associated of Pain Management and Anesthesiologist, so an anesthesiologist journal. Atlanto-axial subluxation or misalignments. So combination, clinical presentation, and this is the primary thing. These misalignments are primarily what are going to cause migraine headaches. So signs that you have these misalignments, maybe not migraine headaches, maybe just headaches, or other conditions that these misalignments will cause. Again, an anesthesiologist journal saying that clinical presentation, atlanto-occipital or misalignments of the upper cervical spine, occipital, suboccipital headaches in the back of the skull, bottom of the skull, upper neck there, reduced range of motion in the cervical spine, neck pain, nausea, infrequent, insomnia. So again, I see that all the time. Migraine sufferers, headache sufferers, oftentimes autonomic dysfunction is going to cause insomnia because the elevated sympathetic tone, not allowing the body to go into full rest. Pain or restriction in nodding movements. Referred pain to the preauricular area. Trigeminal pain. Blurry vision. Tinnitus, ringing in the ears. So all those symptoms of upper cervical misalignment, so get to a good chiropractor if you have those issues. Effectiveness is a high-dose riboflavin, already talked about that as an alternative, more effective without side effects, mentioned in that Journal of American Medical Association article. Linda, thanks for tuning in. Gina, thanks, great to see you online here. Earlier in the video, he was talking about veterans with TBI, PTSD, etc. He is offering to help them with a much lower rate. Yes, Linda, thanks for... So hopefully, I'm guessing, Gina, if you're still online, call my office. You go to wilddoc.com, you can submit email there to us, or you can call our office, 931-591-2010. Online there, just call us, let us know, you know what, over the next 2 weeks, celebration of, the 4th of July, I get to celebrate freedom. It isn't free. I pay for it for my tax dollars, which then doesn't transfer over into very much pay for our military members, sadly. They deserve a lot more. But you know what? We're going to give you a discounted rate, big time. First treatment, all initial evaluation, x-rays, anything that's necessary for me to evaluate autonomic dysfunction, upper cervical traumas, misalignments, if I need x-rays, everything, which is typically around $200 and some odd dollars. My staff take care of all the finances, I don't. So, but you come in, I think we got it set at $50 for everything that's involved, including treatment, all the treatment necessary on the first visit. So get in, get those military members in, let's get them help. All right, so Brandon, thanks for tuning in there, buddy. Again, I love seeing people tune in. Please make sure that you share the truth. Man, we all know somebody. If this is affecting, if childhood migraines are affecting 10% of the population of our children right now, you know somebody. You know somebody at your church, at your school, the kids. Ask your kids. Look at your kids. Be like, who in your class has migraine headaches? And you literally go to them and you say you're gonna get, you write down the title of this once it's on my website, thewilddoc.com, and you say you got to go watch the Wild Doc's analysis and break down the literature and the research, understanding what migraine headaches, where they come from. You help those children. We got to help people. Because right now our medical and healthcare system is not correcting causes. They're not even looking to help people reduce the risk of side effects from their medications. They're not even talking about the placebo being more effective than their darn drugs. They're not talking about alternatives. They're not talking about causes. They're just treating symptoms. And they're making bank on it. It's ridiculous. So we got to get out there and we got to reach out to the community. Grass-level effort. Grassroots effort is what's got to happen. All right, after fine, Botox. Oh, I just had to pull this study, or this article. So New York Times back in 2010 had an article about Botox injections. So after a fine, after agreeing to pay $600 million to resolve criminal and civil complaints of illegal marketing of their Botox injections and Allergan, maker of Botox, so this company illegally markets, bribes doctors to use Botox, lies about the safety of the drug. They pay $600 million to resolve criminal and civil complaints of illegal marketing tactics, and then they seek FDA approval after that. Oh, that's nice. So you committed a crime, and then now we're going to give you FDA approval for your. That's nice. So we're just okay with criminals being able to just manipulate our medical practices. The drug's effect was generally last about 3 to 4 months. The headache shots could cost $1,000 to $2,000 for each of those sessions, industry analysis said, which would take about 4 sessions a year. So that's $6,000 to $8,000 approximately that you're going to spend on migraine headaches with Botox, for which, get this, folks, patients who received Botox shots had, on average, 2.3 fewer headache days per month. Several $1,000s for and I get, okay, listen, I don't deal with migraine headaches. I've seen people who do. I've seen people crying in my office when they come in here to get care. You know what? And walk out feeling a whole lot better. Should I be able to charge for each session $2,000 to $3,000? And if I get really specific, I'll do it 3 or 4 times a year. Resolve their migraine headaches. Once I do that, pay me $8,000. Okay, I'll make an offer right now. Anybody wants to come in here? All right, I'll give you a money back guarantee. You pay me $8,000. You put $8,000 down on the table. You know what? If I can't get rid of your migraine headaches, and you don't sustain improvement for longer with those darn Botox injections do, I'll give you your money back. I wonder if anybody would ever take me up on that offer. Because get that, like, seriously, you pay for results, don't you? That's not results. That's symptomatic treatment. That's not true results. That's not better health. And then on top of that, patients in one study sponsored by Allergan, for example, the drug company sponsored the study, which is going to make it really typical for them to actually skew the statistics and lie about the effectiveness, had literally 5 fewer headaches a month than had before, no matter whether they had the injection of Botox or a placebo. So literally, again, placebo worked just as well. And then they said, well, we saw 2.3 fewer headache days on a month. And then they talk about the side effects. The agency requires all botulinum, Botox is in botulism, toxin to carry a black box warning label that the drug could spread to other parts of the body, causing difficulty in breathing and swallowing, in essence, paralysis of your ability to breathe. So your diaphragm doesn't work anymore. That's nice because you got nerves that branch out of your neck that go down to the diaphragm and control it, contraction of it, so you can breathe properly. Well, I'm sorry, you may paralyze that nerve and then you won't be able to breathe very well. This is 30 needle jabs 4 times a year. That's 120 needle jabs you'll get for around $8,000. Oh, and then here's another one. Fantastic. Well, at least they're getting close to understanding what the cause is and close to actually correcting it, but I still don't think we should cut up the body and cut parts of the body off or out. So here we go. 5-year outcome of surgical treatment for migraine headaches. Anyways, I'm not going to dwell on this too long, but get this. Although the percentage of patients who observe complete elimination of migraine headaches is not substantial from that, but it was substantial in chiropractic care. Autonomic nervous system dysfunction. So here, the final thoughts here. I know that I've mentioned it already. I know that we got some questions online here. Ashley, calling first thing tomorrow. We'll drive 8 hours. Awesome, Ashley. I had somebody come in from Chicago. I've had people fly in from all the way from Las Vegas, Nevada, for a little girl that had a stroke. We saw improvements with her. I got people that travel from all over the world. I want people to understand. And the reality is I eventually would love to train other doctors and do that, you know, and I'm still in learning right now. I don't think I'm ready to do that, but I think, you know what, I want to see that happen. I want to see people not have to go the ends of the earth to find help. You know, we need to get, if we had medical physicians studying this stuff and saying, you know what, it's not about the profit, it's about the people. We need to do what's best. We need to take the best medical literature out there, understand and look and search for a cause, not search for another cure in a medical concoction. You know what, we'd have more people available to help other people resolve these issues. We wouldn't have so many people suffering with this condition. But here's the important takeaway here. You have to understand that headaches are a significant warning sign. It is the check engine light blaring at you. If you had an alarm in your car to go off, you know what? That's your check engine. That's your migraine headache right now. Autonomic nervous system dysfunction. Autonomic dysfunction in childhood migraines. Our results demonstrate ANS dysfunction and hyperactivity of both the sympathetic and parasympathetic nervous systems in children with migraine headaches. All right, that study is from 1999, pediatrics. Pediatrics, they're saying it. They understand autonomic dysfunction. That's one of the major tests I do in my clinic is autonomic function analysis. We do heart rate variability studies. One of the best ways to tell whether the autonomic nervous system is functioning well. Because it's important, it's critically important to understand that the nervous system is doing well. We need to improve autonomic function. That's my primary goal. Why? Because the nervous system controls and regulates every physiological system in our body. Our heartbeat, our regulation of our inflammation, our immune responses, our digestion, everything is controlled by the nervous system. So if our nervous system is dysfunctional, if it's out of whack, if we don't get to the source and cause of that, this person, that patient is going to suffer over their lifetime. They have higher risk of all-cause mortality. They, in fact, show in the medical literature that an individual with high autonomic dysfunction or poor heart rate variability studies, this includes migraines, headaches, they have an increased risk of unexplainable death, sudden cardiac arrest, cardiac stroke risk, increase in diabetes, increase in autoimmune conditions. Because if the nervous system doesn't function well, nothing's going right. It's kind of like if mama ain't happy, ain't nobody happy. If your nervous system ain't happy, ain't nobody happy in your system. That's the way it is. You have to see the nervous system as a foundation. It's one of those key foundational things we need to address to make sure that we're doing best for our patients, to make sure that we're doing best by you, the people out there, that I'm here to serve, that every physician should be here to serve. So, autonomic nervous system function in childhood migraines. Our results again demonstrate ANS dysfunction, hyperactivity. This Pediatrics International, again, sympathetic tone. Studies have reported normal ANS dysfunction where in patients, whereas others have reported sympathetic nervous system dysfunction. Both sympathetic nervous system and parasympathetic nervous system dysfunction in children with migraines. ADHD, a comorbid. That means it's a cofactor. It's another thing that's going on in these children with migraines. So children with migraines also have an increased risk of ADHD. Again, go back to that high sympathetic tone. You know what? If you're running from a tiger, you're going to be all over the place looking for a tree to climb and a weapon to fight with. You know, you're not going to be able to sit down, concentrate, and learn. If your sympathetic system is elevated, you're going to be all over the place. You're not going to be calm. You're not going to sit still because you're going to be fidgety. You're going to be anxious. You're going to be nervous. You're going to be all over the place. You know what? You're not focused, not learn. You know, a lot of people in a significant stress response, when they get in a car accident, they're in a fire, something like that, they're in a shooting, you know what? They can't remember how they got out of the building. All they know is they got out of that fire. All they know is they got out of that car accident okay. They can't remember it. Memory shuts down. Certain areas of the brain shut down for temporary ability to shift energy towards survival. All right, that is ADHD in the true form, if we're going to call ADHD a true diagnosis. But there's a lot of children out there that are being fed artificial sweeteners, junk. They're just out of whack because of high sugar content in their foods, junk foods, and they're not given recess anymore. And they got ADHD because of that. They don't get enough time to go outside and play like normal kids should be able to. You know, so if it's a true ADHD, if we were going to call ADHD a true diagnosis, then it's autonomic dysfunction. Migraines linked to fatal cardiovascular disease. People who suffer from migraine headaches face heightened long-term risk of cardiovascular disease and death, according to 2 large studies. There's a 27% higher risk of cardiovascular mortality. University of Iceland. Colleagues reported we're reporting this, coming to you live, reporting from Iceland. Anyways, I need to slow down and just have fun with this now. Jennifer, what about vertigo? Vertigo, again, that would be a cerebellar issue, but vertigo would be like dizziness. You can get vertigo from adrenal fatigue, which again, autonomic high sympathetic tone over the long term will cause eventually adrenal fatigue and adrenal exhaustion and adrenal failure. So you've got to correct upper cervical, or the sympathetic tone can be out of whack because of other spinal misalignments with that would be more like POTS, postural orthostatic tachycardia, or faintness, blurred vision, low blood pressure when you go from laying down to standing up. Those are typical with spinal misalignments as well. Jennifer, we're going to be able to help you. That's all I can say. You deal with that badly, we're going to be able to help you with vertigo. I've helped a lot of patients with vertigo. It's upper cervical again, the head position, the writing reflexes. You have eyes, ears, okay, your eyes and your ears, vestibular system, and your upper cervical alignment is going to determine where you are and tell your brain where you are in space. You can see the horizon, keep yourself balanced that way, shut your eyes. Now it's on your vestibular system as well as your upper cervical and the mechanics and your mechanoreceptors of the joints of your spine and your feet and all joints. But primarily the upper cervical spine has more mechanoreceptors sending information to your cerebellum for regulating where you are in space and telling your brain where you are in space, and communication back and forth from the joints, the vestibular system, and the eyes is going to allow you to know where you are in balancing, okay? If that's out of whack, that's going to contribute to vestibular issues or also to balance issues, so we'll be able to help you there. Migraine sufferers were 22% more likely to die from coronary artery disease and 30% more likely to die from stroke compared to people. This is my call to action. This is lighting a fire underneath your rear end if you have migraine headaches and you're taking drugs right now. Stop taking your medications, take a placebo pill because it actually worked better, but now that I told you that a placebo pill, it might not work as effectively, so I actually did you harm, so I apologize for that. But a placebo is actually more effective than 2 medications to prevent migraine headaches. So, but your increased risk and those medications, listen to this, I want to make sure that I get to this subject because it's ridiculous to me. Second study, also published in British Medical Journal, Harvard University in Boston, University as well as the University of Paris. Colleagues found that women with active migraines and aura had more than double the risk of hemorrhagic stroke compared to those with migraines. Okay, and now take this back into, if you've heard that, so you have an increased risk of migraine headache, you then have an indicator that shows you that you're at increased risk of stroke, hemorrhagic, bleeding on the brain stroke. So you take the situations with individuals that will go to a chiropractor and shortly after have a stroke. Well, a lot of times they'll go to a chiropractor with a severe migraine headache. They're already having tearing of the blood vessels, and the chiropractor can't really understand that this may be the worst headache in their life, they need to be sent to the emergency room, there's a time and place for that. They don't correct the misalignment, and the migraine headache continues, and eventually it leads to the complete rupture of the arteries. That's why the peer-reviewed medical literature, a systematic review of all the medical literature and an analysis of individuals after medical physician's office visits or chiropractic office visits, people are more likely to have stroke or cardiovascular rupture after a medical physician's office visit than a chiropractic office visit. So we can actually, according to that data, reduce your risk of stroke. So migraine headaches might represent a systemic disorder of the vascular and heightened vascular reactivity even in early adulthood. Migraine with aura is an independent risk factor for cardiovascular and all-cause mortality in men and women, but weaker than risk factors such as smoking, diabetes, or high blood pressure, because those are worsening effects. Now, with children with their increased arterial wall thickness, okay, these other studies, thicker intima media carotid wall was found in a cohort of children with recent onset of migraine headaches. So, the study showed that children with migraine had a significantly thicker intima media carotid wall. So that's the arterial walls around the heart, supporting the theory that a congenital alteration of the vascular structure was a predisposing factor to migraines in this cohort. But it wasn't. They see that people with migraine headaches can have no cardiovascular issue, and then people will have normal heart function, and then eventually they develop migraines, and then eventually they have cardiac problems. So evaluation of carotid, again, another study showing migraine is commonly seen neurovascular disorder during childhood. Inflammation induced by the activation of cytokines and neuropeptides is implied in the pathophysiology of migraines, thus leading to atherosclerosis, hardening and plaquing of their arteries, which develops in context of the chronic inflammation. Better study, they got close. So, but it didn't have increased risk factors that are normally evaluating the increased risk cardiovascular, such as cholesterol and other blood markers. So the best way to determine whether you're increased risk of cardiovascular disease is literally if you have migraine headaches, yes, you are. So women with migraines were 2.7 times more likely to suffer intracerebellar hemorrhagic stroke and 3.5 times more likely to suffer fatal hemorrhagic stroke compared to women without migraines. So we have to get to the cause. That's what I'm hammering home here right now. An important concern, they note, is whether clinicians, get this, so these are the authors. This is one of those things where you just have to sit back and say, what are they thinking? Are they really serious about this? And I'm going to play like advocate here for them, I guess. I don't know why I would do that, but I will. An important concern, they note, is whether clinicians, doctors, should inform patients with migraines about their potential risk for future vascular disorders, noting this could create undue anxiety in some patients. So they're literally telling other doctors, British Medical Journal, showing that they're showing that migraine headaches are a significant indicator of an increased risk of stroke or heart attack, especially in women. All right? You know what? If I was a husband, my wife was having migraines, you know what? I'm like, we need to correct that. And my wife used to have severe migraine headaches. Periodically, she's got one of the worst atlas alignments I've ever seen in my entire life. So I'm just like talking about my wife here. You know what? It breaks my heart because we saw massive improvements under chiropractic care before me and her were married. All right? So my best friends caring for her, Jason and Jenny Kessler, down in Nashville, taking care of her, getting her adjusted. Her migraine headaches came way down. She really needs to work. She's had an increase after childhood, or after having 2 children. You know, that's a lot of stress on the structure of the spine. So right now we're rehabilitating that. She's strengthening it. She's back into her exercises more, but she's looking down a lot more. She's got to carry a baby a lot more. So she's got a lot more stress. She's had a slight increase there, but again, she had almost 7 degrees of rotation of her atlas, which over 4 degrees is indicative of ligament damage. 7 degrees of the atlas being twisted in reference to the skull is indicative of ligament damage. So we have to be very specific with our adjustments. And you know what? She's improved significantly, not completely resolved. I wish we could see it. You know, it's one of those most frustrating things when I can see I take care of other people in my office and 100% resolution of their headaches and their migraines, and I can't yet do that with my wife. So it's like me just talking to you out there right now. It breaks my heart that I can't reach that level of improvement with my wife yet. but I'd love to, because it interrupts her life. It interrupts my life and the kids' lives. I've got to take care of the kids. I got to do the dishes when she's got a migraine headache. I got to make the bed when she's got a migraine. I got to do the laundry when she's got a migraine headache. She's probably on here right now saying, "Yeah, right, Dale. I'm still doing that even when I'm in pain." Because I got she always jokes around. I got like the man cold. Whenever I get the man cold, like I can't do anything, and she's got the mama cold. She's like doing everything still. Got to applaud women for that. They are amazing. So where was I? What do I need to do with my closing statements here? We just got to get to the root causes. We just have to. We got to understand, back to those medical physicians, I can't understand it. How in the world can they find significant evidence of serious risk to someone's life, livelihood, their future health? You know what? Why don't they tell people, listen, the medications we're giving you increase your risk of stroke and heart attack, increase your risk of major side effect. A placebo works better than a drug, so we're not going to tell people what we're giving. We're just going to give out sugar pills anymore for migraine headaches. But in the meantime, while we give them the sugar pill, we're going to tell them to go to a specific upper cervical chiropractor who does structural correction, that corrects, works the muscles, everything, does very specific work. A neurologically based chiropractor, someone who's going to correct the autonomic function issue that is causing that migraine headache, those migraines. They need to do that if they want to do best by their patients. That's a call to action to any medical physician watching this right now. When you look at the evidence, the migraine medication, prevention medications have serious side effects. Placebos work just as well, if not better, according to the peer-reviewed medical literature, especially in children. Chiropractic care had sustained benefit over the long term after discontinuing and not even continuing to get adjusted. Still had sustained improvement, alluding and showing that we are correcting the underlying cause of migraines. Otherwise, it would come back if it was just a placebo effect, or it was just symptomatic treatment. Now, the next studies that I believe we need to have funded in the realm of looking at what we could do to benefit people beyond just getting rid of the migraine. If we're correcting the underlying cause, and truly are, we should see improvements in the vascular system. So if we see improvements in the autonomic function, which when I measure the autonomic system, I see improvements in autonomic function once migraines are resolved. So when we see improvements in heart rate variability studies, we know that the system is working better. So through that process and looking at the massive body of literature and evidence that shows autonomic function as that improves, likelihood of developing cancer, having a stroke, having a heart attack, unexplainable death, fighting off illness, all of those things, or all of those risks of disease in the person's future go down, the higher their heart rate variability is, or the better we can get their heart rate variability, then we can take and say that chiropractic care could reduce the risk of all those different disease processes, because we know we can improve the autonomic dysfunction with very specific neurologically based chiropractic care. So through that process, we can say, let's do studies now. Let's take children with migraine headaches. Let's give them the best chiropractic care, not general manipulation care, but very, very specific chiropractic care. Looking at the upper cervical, correcting those misalignments, and then watching and doing the studies that they did. With these studies, doing ultrasound and tests on the heart and cardiovascular system, looking at the intermediate thickness, we should then be able to see improvements in the cardiovascular health if we're getting to the root cause. You know what? That's the best study that could be done right now. So I'm call to action out there to the NIH, National Institute of Health, if you want to fund me and allow me to do research on this. Maybe I could apply for research grants. Maybe I need to talk to IPAC, Institute for IPAC is a great institute. It's a great, I believe it's going to be a great medically research-based for pure and applied knowledge. Institute for Pure and Applied Knowledge. Look them up. They want to bring the truth to the American people with pure and applied knowledge in the medical literature. These are researchers, medical physicians, PhDs, people who want to get data and information out there to best help society maintain their health and become healthier. So maybe we could get funding through them for this type of study. But we need to look at that. We need to see if we're reducing that risk. That study would be the next step in seeing that chiropractic, so this is a call to the chiropractic community. We need to do these types of studies. We need to see. We know we improve autonomic dysfunction. We know that we correct the nervous system function, so we know that we see migraine headaches decline or completely eliminate, so we know we're getting to the cause of those. From there, we need to see, are we seeing an improvement in the intermediate thickness, the carotid artery thickness, and if we are, we can then solidify the fact that chiropractic care can reduce stroke and heart attack risk and cardiovascular mortality. Now, there are studies in the medical world through osteopaths that show that blood pressure, and that's another study with chiropractors and medical physicians up at the University of Chicago, showed that blood pressure was improved with specific upper cervical correction chiropractic care by specifically adjusting this area of the spine. And again, migraines have an increased risk of developing blood pressure issues in the future. So again, all of those things are correlated. All of those, in essence, I believe, are the same cause. If we can get that and correct that, we're going to help people in society live a higher quality of life and better health. So that's my call to action. But so here's my playing devil's advocate for them, or advocating for the medical community. Like, they're actually they're saying, don't tell women because you could stress them out. Don't actually tell people that migraines are an increased risk of stroke. So they would say, don't put this information out there. Yet it was in mainstream media for a little bit, and then it's in British Medical Journal, so people could access that information. But they're telling doctors not to tell people that. But I believe we should tell people that, because then understanding that is a check engine light, people understand what a check engine light is. They understand if they keep driving on a check engine light, at least most people do, that they understand that their engine could blow up. They could be in a worse situation. They'd be stuck on the side of the highway. Sadly, though, the medical community works like this. They're the guys, they're like the mechanics. You drive into the mechanic shop and you say, hey, my check engine light's on. They walk out and say, oh, I got Advil for that. It's a piece of duct tape. Slap it over your check engine light. And they say, there you go, no more check engine light, right? No more headache. Bye-bye now. See ya. That's a couple $1,000s. All right, don't worry, your insurance will pay for most of it, but you pay your premiums that are astronomical, and then we still receive the money. So it's just a funneling system for the money to go in the hands of stockholders, big business, the government, and then into the medical physician's hands and then the drug company's hands. So that's the way the system works. That system works. So you know what? What they do is they slap that piece of duct tape over your check engine light and say, there you go, go on your way. They don't actually warn you what that indicates. It indicates your engine's about to blow. You're about to have you're literally at an increased risk of stroke and heart attack and cardiovascular risk. So they don't explain that to you because they don't want to. Because they don't want you to ask, how do I correct the cause then? How do I reduce that stroke risk? Well, the medical physician have to look at it, well, I don't have an ability to do that. Medications would actually increase that risk. So once they start actually being truthful with you, you would be like, well, I'm not going to take your drugs. I'm going to take a placebo, or I'm going to go find someone who can actually help me correct the underlying cause. But again, going back to that scenario, mechanic slaps your check. Are you happy with that? Would you be happy with a mechanic slapping a piece of duct tape over your check engine light for your car? So is your car more valuable than you are? Why do we allow medical physicians to literally do that in our healthcare system? That's what's going on, folks. So you keep driving down the road. Your engine blows up. Same system, same doctors. They pull up in the ambulance. Now you got to pay them even more money. Well, they'll tow you into the hospital. Tow you into the hospital with their ambulance, their tow truck, and then they're like, well, your engine blew up. Well, my engine went. We don't really know. It just happens. Diet and lifestyle and exercise, right? That's it. No, it's not it. Then they get a lot more money for rebuilding your engine, doing the bypass surgery and the emergency medical treatment. And the system just keeps profiting on not telling people the truth. That's sad. Unacceptable to me. I think we should tell people the truth, give them the information necessary to make the right healthcare decisions in their life. And that's one of the biggest things that I'm advocating this day and age. Kate, good to see you online here. Doc has helped relieve my migraine headaches with his chiropractic care and strengthening exercise. Correct diet helps too. Excellent, Kate. Multifaceted, laying down the foundation. Liz is online. Love your YouTube videos. I appreciate that, Liz. Hi from Santa Fe, New Mexico. Awesome. New Mexico is beautiful territory, I've heard. Liz, big old smiles. Cookie not telling is just as bad as lying. Withholding truth is a lie, in my opinion. I agree. Dwayne Kirchner. Dwayne here online. Sorry, I just said your last name with this. Okay. My 7-year-old daughter has been suffering with headaches in the center of her forehead. The pediatrician has figured
Hasn't figured anything out. Sorry to hear that, Dwayne. So, where should we start at to try and find out what the cause is? First thing I would do in my clinic is I'm going to do heart rate variability studies on your child, 7 years old. At that age, I'm going to weigh, look at the severity, I'm going to palpate, I'm going to feel the upper cervical spine, I'm going to look at range of motion. You can look and observe mechanics through range of motion, movement, nodding, exercise, different movements of the cervical spine. You can look, you can have them close their eyes, tilt their head back, their head goes off to one direction. We know we got upper cervical misalignments. Depending on which direction it shifts, can actually show you where there may be instability of the ligaments or the muscles for correction. And then from there, Dwayne, looking at, again, the autonomic dysfunction will tell us whether we're sympathetic dominant or parasympathetic and sympathetic dominant, and that can change some of the adjustment techniques that I utilize in my clinic, looking at that autonomic function issue. So those are the biggest things that you can start with. Right now, in the meantime, Dwayne, what I would recommend is utilize the riboflavin B2, high doses of riboflavin found safe and effective in helping with migraine headaches, so try that. It's a safe alternative. In the meantime, in the temporary, while you go make sure that her neck is out of alignment. Because again, I don't advocate acupuncture, different techniques like that can help, and they're phenomenal compared to medication, side effect laden drugs. So they're not risky, they're beneficial, they can help people. But the reality is, I asked that question, is the lack of needles sticking in my body or a piercing the cause of my migraine headaches? No, it's not. But now I will state that acupuncture has shown to downregulate that autonomic dysfunction in the nervous system. So there's a beneficial effect on the autonomic system. So there is huge benefit there too. But if the misalignments of the neck are what's causing the autonomic dysfunction, we need to correct those. Otherwise, we're looking at arthritis, deteriorative disc disease, deteriorative joint disease, and eventually needles just aren't, acupuncture just isn't going to cut it anymore. And that's what I see in people that have used acupuncture, and then they resort to chiropractic care as a last resort because eventually the acupuncture wasn't working or the supplements weren't working. But again, Dwayne, you can utilize an anti-inflammatory diet, removing gluten, dairy, allergenic foods, reduces inflammation in the gut, looking at riboflavin, looking at vitamin B2, utilizing that to improve vascular health and downregulating inflammatory cytokines, improving your daughter's headaches, hopefully, through that manner. But again, gotta check, gotta get to an upper cervical specific chiropractor, neurologically based chiropractor. If you're in the area, Dwayne, give my office a call, 931-591-2010. And you can actually call us if you want to, and my staff are more than willing to help people out, try and find somebody locally to their area that I may know personally that could help you as well or help your daughter. So thanks for tuning in, Dwayne. Share the information. Liz, we need to fund a natural health care instead of the FDA. Oh boy, don't we ever. I read in, now that you bring up government agencies, do you know that your taxpayer money, folks, went to pay for prostitutes at CDC events? Yeah, sex workers at CDC events. Yeah, that's where your money went. Our taxpayer dollars actually paid for that. Yeah, it's called CDC Off-Center, a senator. I don't think he's in Congress anymore. Oddly enough, he didn't get re-voted in after he called out the CDC for their improper use of taxpayer funds, right? Yeah, graphic, yeah, you just got to read the CDC Off-Center. Just get that senator's review of what the CDC does with our taxpayer money. It's sickening. Cookie tunes in again, says, not many doctors want to find underlying causes. They don't even know where to begin. I don't think they want the headaches. I don't think they want that cookie, I don't know if you find the irony in that, what you just said there. So doctors don't want to find the underlying causes of migraine headaches because they don't want the headache of actually having to do work. I just thought that funny. So anybody else can laugh if you want to, or you don't have to, because things are funny to me and sometimes not to others. They get paid more if they can get more patients in and prescribe more medications, and then they get more money for treating the side effects of the drug. You should be disgusted. I am too.
Awesome, Dwayne. Glad you're still tuning in. I pray and hope your little girl gets the help she needs. So, and you can rest easy at night. So, thank you for your time. Actually, absolutely, Cookie. Thank you for tuning in. May God bless you always. So, thank you guys. Thank you for tuning in. I know that some of you stayed online. We get a lot of people tuning in here. I hope and pray this gets to parents with children suffering from migraines. I hope it gets to anybody with migraines, because this isn't just specifically for children. It's not like children have the misalignments and adults don't. You know what? In my clinic, I see over 90% improvement in migraine headaches. I see the majority of people completely resolve their migraine headaches when we get specific with our exercises and our adjustments. And I see every single person I've seen improve in some way, shape, or form with their headaches or migraines in my clinic. Some complete resolution and some minor. The majority get complete resolution when we can correct those underlying causes, and we do. So y'all be good. Take care. Bye-bye now. Hey everybody, I'm the Wild Doc, and if you enjoyed this video, make sure that you hop on over to thewilddoc.com. Subscribe there for our newsletter and email campaign. Join in the conversation on Facebook, and let's transform the world by unleashing the power of natural healing.